What is capnography and how does it work? Capnography is the non-invasive measurement of the partial pressure of carbon dioxide in the exhaled breath, called end-tidal CO2. Capnography continuously evaluates the adequacy of ventilation and airway patency. Recently, the applications for capnography have expanded outside of the operating room, specifically for monitoring ventilation in patients who are receiving post-operative opioids. Opioid medications are widely utilized with patient-controlled analgesia, or PCA, to manage post-operative pain. However, every patient who is receiving PCA or neuraxial opioids is at risk for clinically significant opioid-induced respiratory depression. If respiratory depression is detected early, most cases can be treated. However, if respiratory depression goes undetected and untreated, it can progress to potentially fatal respiratory failure. According to the Healthgrade's annual studies on patient safety in American hospitals, post-operative respiratory failure is one of the highest patient safety indicators. In fact, post-operative respiratory failure has an incident rate higher than that of sepsis, costing the U.S. healthcare system over $1 billion annually. Therefore, it is essential to detect a patient's declining ventilatory status. The signs and symptoms of opioid-induced respiratory depression include decreased level of consciousness, hypotension, and a decreased adequacy of respirations, not just respiratory rate. Obtaining a respiration rate at prescribed intervals is not adequate to detect a declining ventilatory status. Opioids can depress all phases of respiratory activity, including respiration rate, tidal and minute volumes, gas exchange, and rhythm. Capnography monitors ventilation. It calculates respiratory rate through respiratory gas movement at the mouth or nose. Capnography provides an accurate respiratory rate while also monitoring adequacy of ventilation and airway patency with each breath. It also recognizes airway obstruction and apnea events. Capnography provides continuous, real-time, breath-to-breath feedback on a patient's status and allows the clinician to determine a baseline ventilatory status and to track changes over time. The capnography alarm alerts the clinician for early intervention before clinical assessments and more effectively than pulse oximetry. Question 1. Identify the patient safety risks associated with PCA-delivered medications. A. Increased alertness. B. Undetected respiratory depression. C. Potential fatal respiratory failure. D. Both B and C. The correct answer is D. Every patient who is receiving patient-controlled analgesia, PCA, or neuraxial opioids is at risk for clinically significant opioid-induced respiratory depression. That can become fatal if undetected and untreated. Question 2. Capnography digitally records a respiratory rate in real time while also monitoring adequacy of ventilation and airway patency with each breath. A. True. B. False. The correct answer is A. True. Capnography digitally records a respiratory rate in real time. Together, the end-tidal CO2 and the respiration rate indicate the adequacy of ventilation and the waveform. A graphic representation of each breath indicates airway patency.